Hola, muy buenos días a todos. Bienvenidos al ciclo de formación, trabajo, salud, estrés, realizado por ARL SURA en convenio con Prax, el Centro de Epidemiología Social y el Grupo de Investigación Estrés y Salud de la Universidad de los Andes. Antes que nada, mi nombre es Giselle Zapotitla, soy profesional de educación de la ARL SURA y líder de este ciclo de formación. Me confirman, por favor, que me estén escuchando perfectamente.
Correcto, te escuchamos muy bien, Giselle.
Para empezar, quiero hacer algunas claridades a los componentes técnicos temáticos que hacen parte de este especial ciclo de formación. Nuestro ciclo se compone de 4 ejes temáticos. En el primer eje vamos a desarrollar contenidos asociados a la conceptualización y causas del estrés. En el segundo eje vamos a hablar sobre el impacto del estrés laboral en las personas, en las organizaciones y en las sociedades. En el tercer vamos a hablar sobre la evaluación y diagnóstico del estrés laboral y sus consecuencias para las personas y las organizaciones. Y en el último, no menos importante, vamos a hablar sobre la intervención del estrés laboral a nivel individual, organizacional y social. Es importante resaltar que este ciclo especializado de formación cuenta con 10 conferencistas de 4 países diferentes, expertos y referentes a nivel mundial en cada uno de los campos de trabajo. En total, tenemos el privilegio de ser partícipes de 15 horas de formación. El evento además cuenta con la participación masiva de 1.586 personas, correspondientes a 747 empresas de 114 actividades económicas, que al final tendrán la oportunidad de impactar positivamente a 626.388 personas o trabajadores. Esto es muy importante porque con este aprendizaje podrá co-crear nuevas experiencias de trabajo. Para la ARL SURA es realmente un placer contar con ustedes, con su participación. Recuerden que pueden escuchar este evento en su idioma original o bien con traducción simultánea. Para seleccionar la opción de su preferencia, deben dar clic en el icono de idioma que se encuentra en la parte inferior. La traducción simultánea está activa durante todo el evento y para esto nos acompaña Laura Muñoz, quien desarrollará esta actividad. Bienvenida, Laura. Además de esto, para compartir comentarios, expresiones, reacciones, usted puede utilizar también la opción del chat. Las preguntas para los conferencistas son a través de la opción de preguntas y respuestas. Los últimos 30 minutos asignados a esta conferencia serán destinados específicamente para resolver todas las inquietudes que ustedes nos postulen allí. La asistencia será tomada en cualquier momento del espacio y pondremos un enlace a través del chat. Es fundamental que estén muy atentos durante toda la jornada para que puedan inscribirse en la asistencia, ya que esta estará únicamente por algunos minutos. El certificado de asistencia será entregado a quienes participen activamente durante todo el ciclo modular que está contenido en 10 conferencias. Y se enviará a los correos electrónicos aproximadamente 8 días hábiles después de que haya terminado nuestra última conferencia. Además de esto, usted podrá revivir nuevamente este espacio educativo revisando los videos que quedarán consignados en la plataforma de YouTube en el canal de Prax. Este también lo podrá compartir para que otras personas puedan tener acceso a este valiosísimo conocimiento. Ya para finalizar, y no menos importante, le doy la bienvenida a la doctora Viviola Gómez. Viviola es directora del Grupo de Investigación, Estrés y Salud de la Universidad de los Andes y quien nos acompañó y diseñó la propuesta pedagógica de este importante ciclo de formación especializada internacional. Muchísimas gracias a todos por sus conexiones. Bienvenida, Viviola. Muy buenos días.
Gracias, Giselle. Hay muchas personas que están, antes de decir lo que quiero decir, quiero preguntar si con mi presentación mejoran el sonido, porque claramente cuando Giselle estaba hablando, yo creo que Giselle no tiene una muy buena conexión y por eso el sonido estaba como estaba. Entonces veo que ya
Te escuchamos perfectamente.
Ok,
Sí,
sí,
señora.
ahora sí se escucha y quería confirmarlo. Y recordarle a las personas que el chat de preguntas y respuestas solamente lo utilicemos para preguntas y respuestas, y en el chat del otro lado pueden hacer otro tipo de reacciones. Es para que no hablemos sobre otras cosas, sobre el sonido en lo que se llama preguntas y respuestas. Dicho esto, y lo digo porque vi muchas reacciones y estaba tratando yo de reaccionar a ellas, quiero darles la bienvenida a el inicio de este evento tan importante que estamos haciendo con tanta ilusión, porque creemos que de esta manera vamos a poder impactar y ayudar a las personas que en este país se ocupan de la salud ocupacional a tener una mejor comprensión de esta situación. Empezamos no menos que con la persona o una de las personas más conocidas en el mundo por sus aportes a la comprensión del estrés en el trabajo, de las condiciones que generan el estrés en el trabajo y cuál es el impacto que el estrés puede tener en la salud de las personas. Yo me place presentarles al profesor Johannes Siegrist. Él mismo les va a comentar cuál es su trayectoria y toda la evidencia que él tiene para sustentar lo que él está proponiendo. Yo creo que es de las personas que más ha hecho en el mundo entero en la historia sobre la psicología de la salud ocupacional, de manera que espero que ustedes puedan disfrutar su presentación. Y dicho esto, creo que pasemos mejor a escucharlo a él, que es quien tiene muchas cosas que enseñarnos. Bienvenidos.
Professor Siegrist, welcome. We hear you.
Okay. Can I start?
Yes.
Yes, hello. Thank you very much for your invitation. And my presentation will be from work stress to mental and physical disease, what we know and what we can do. Next. Next slide, please. Yes. This is a series of lectures, and today is the first lecture out of 10 different presentations. And the general aim of this series is the following. The world of work and employment underwent far-reaching transformations in recent times, with substantial effects on workers' health and well-being. Now, scientific research has produced important new findings into the health effects of these transformations, using expertise from medicine, from psychology, sociology, and epidemiology. Transferring these new insights from science to practical action and policy is crucial, because these insights can guide the development of preventive activities towards strengthening sustainable and healthy work. So these are the...
Professor Siegrist, so sorry that I interrupt you, but some people tell to us that they have some issues with the translation. So please give us 1 minute. We are going to request to Laura to improve the connection to the translation. 1 minute, please. Laura, agradecemos mucho si puedes revisar tu conexión. Parece ser que hay algunas interferencias con la traducción. Al parecer se escucha un poco entrecortado, pareciera ser que tiene que ver con la opción de conexión a internet. Las personas que dominen el lenguaje inglés, los invitamos a que escuchen la conferencia en el idioma original, Quienes no, pueden activar la opción de traducción. Recuerden que lo pueden hacer en el icono que encuentran en la parte inferior de idiomas. Ahí seleccionan el idioma español y escucharán un poquito más bajo al doctor Siegrist y escucharán un poco más alto la voz de Laura que nos está acompañando con la traducción. Esperamos se haya mejorado un poco, lamentamos el inconveniente. Recuerden que estamos en un mundo donde ahora la virtualidad es un elemento fundamental y estamos en este proceso de pulir cada vez más estas herramientas para que faciliten el proceso. Agradecemos su comprensión. Dr. Siegrist, I really appreciate your understanding. Now Laura is doing some improvements in her connection to improve the quality of the translation. We hope that doesn't have any issue anymore. Please continue.
Should I repeat what I have said or can we go on?
You can continue, don't worry.
Okay, next slide.
Yes, sir.
What are the major aspects of recent transformation of work and employment? First, there is a shift from industrial manufacture to the sector of service occupations and information, communication, technology jobs. Second, economic globalization with expansion of free market principles, boosting transnational flows of trade, capital, and labor force. Third, far-reaching impact of new technologies like digitization, artificial intelligence. And finally, there are new health risks of modern work in terms of work intensification, job insecurity, economic crisis, and now more recently, the pandemic shock. So the so-called psychosocial work environment is becoming more important. And this is the topic of my communication. The aims of these lectures are basically to provide a basic understanding of the psychosocial dimension of work and health. What is work stress? How does it affect mind and body? How can it be measured? How can its adverse effects on health be demonstrated? And what can be done to prevent stressful work? So I will try to answer these questions with a selective approach, which I will illustrate based on long-standing research on these topics, which I conducted together with my team over the last few decades. And I hope we will have some time for your questions. Is the translation okay?
Yes, sir.
Thank you.
Looks like everything is working fine. Thank
you. So after a short introduction, I will talk about psychosocial work environment and health. And then importantly, I will raise the question, what can be done to improve healthy work, in particular in your countries? Okay, next. I think we can skip this slide. This just shows that I had a lot of experience in this area. In Latin America, there are certainly severe challenges to the question of work and health. Why? Despite stages of economic growth and technological advances, substantial parts of the workforce in your countries are still exposed to adverse conditions like low job security, high unemployment, a high proportion of informal workers, long working hours, relatively low wages, and a high inequality among incomes. And there's also a high work-related burden of disease. For instance, in many Southern American countries, there's still high rates of work-related accidents. So there is a need for investments into sustainable, healthy work. Next. This need is also emphasized by the United Nations in their Sustainable Development Goal. And goal number 8 says, I quote, "It is important to promote sustained, inclusive, and sustainable economic growth, full and productive employment, and decent work for all." Now, what do we mean by decent work? At least the following issues are important. First, decent work prevents people from violence and from discrimination because it respects basic human rights. Decent work offers a formal work contract with adequate pay and basic social protection. Decent work enables people to access information and to participate in decision-making. Decent work provides basic occupational safety and health services, and it promotes health by reducing physical and psychosocial work stressors. Now, how can we define the way how work impairs your health? Probably you are all familiar with the impact of physical and chemical factors on health. If you have heavy noise, you will have a hearing loss as a health impairment. If you are exposed to asbestos, you will have an increased risk of suffering from cancer. If your job is heavy lifting again and again, you will suffer from back pain. But what about psychosocial factors? How does high work pressure affect your body, or frequent interruptions, or the fear of losing your job, or a very poor low payment and wage? How does it go under the skin of your body? Next. Actually, these questions, for instance, work pressure, they are very relevant. They are highly prevalent. For instance, in Europe, more than 2/3 of all working people indicate that their work pace is dependent on direct demands, that they have restricted promotion prospects, that they have to work at very high speed. Also, long working days for every 3rd working person across Europe. So you can see these experiences are highly prevalent, highly frequent. So just an example, next slide. Next slide, yes. For instance, what do we understand by the work psychosocial factor as a work stressor? We usually make a distinction between demands which you can manage, which you can master. And if you can master and manage, then your body, your organism can recover after the effort. But there are demands which are just overwhelming. they are too strong, and then you cannot cope with them. And this is really a very serious condition of work stress. But even more frequent is the condition of what we term taxing demands. This means that the demands you are working on, you are facing, but you are not sure whether you will succeed or whether you will fail. So we can say work stressors are demands which threaten the working person, which elicit strong negative emotions of anxiety, anger, and frustrations, and which also trigger sustained physiological stress responses within your organism. Next. Yeah, I think we can be very quick here. If you suffer from piecework, clearly the speed of task performance may be too high, then this is an example of an overwhelming demand. For an example of a taxing demand is just continued work pressure. You can cope with it, but it's at the limit of what you can do. Okay, but let's go on. So the normal stress response means that you put all your energy into the solution of the problem at work, of your effort, and that energy for you is also energy of your organism, which stimulates your cardiovascular, your metabolic, and your musculoskeletal responses. So in a way, your body offers a lot of energy for fighting. And if you succeed with your fighting and with your effort, then you can recover, you can relax, and your body can restore. However, if the demand goes on, if it's taxing or overwhelming, you have to adapt again and again, and the stimulation of your physiological responses will go on and go on. There is a continued struggling, and there is a prolonged activation without the ability to recover and to relax and to calm down for recovering. In a next slide, in an image, you can say the level of your stress response will remain high, will remain sustained for hours or even for days, or it will come back again and again for weeks and for months and even for years. And this is exactly the way how stressful work can affect both your body and your psyche. Next. I will not go into details, but there's a lot of basic scientific research on the pathways from experiencing a stressful situation to what is going on in our brain and what are the channels from the brain throughout to the peripheral systems within our body, which activates all responses. Responses are hormones, responses are nerve signals, and responses are cardiovascular reactions like blood pressure increase, heart rate increase, and as I said, release of stress hormones like adrenaline and cortisol. But I will not spend much time on this. This is very basic, and it has been well proven that these mechanisms really work again and again. Next. So the problem is then, how can we define and measure stressful work in a variety of occupations, in a variety of professions? It is impossible to include every detail of these many professions and occupations into one model. This is not possible. It's too complex. It's too diverse. And for these reasons, we need a reduction of this complexity to some very few but very crucial elements which underlie all these different occupations, which you can identify in all different professions, because you define these elements at the high level of abstraction. And then if we can measure these elements, then we can identify the work stress in a variety of different occupations. Now, how can we find such a model, a theoretical model of work stress? Let's go on, next. There are many approaches attempts towards reducing this complexity. But today I will mainly focus on two such models because they have been established worldwide in many, many countries. And the first model will be the topic of the next lecture by Dr. Karasek next week. So I will only briefly focus on this model, which is called the demand control model. And the basic idea of this model is that you can find in many, many occupations a condition where the demands are very high. In particular, the mental, the psychological demands are very high. But at the same time, your ability to control the task is very low. I will show this in a minute as a slide, but this is the basic idea. The model I will focus on with my presentation today is the model that we proposed, and it's termed the effort-reward imbalance model. And the main idea is that you put your efforts every day in your work, and what you get out in terms of a recompense on the other side, that the reward that you get for the effort spent is very low, is unsatisfactory. And this imbalance is really something which produces stressful reactions. Now let's have a look at these models. This is the model of the demand control approach by Karasek and together with his colleague Teres Thiorel. And you can see in the lower part what is called high strain. This is exactly the condition. High demand, but a low amount of decision latitude and of control. So this is actually the critical situation which you can identify in a number of different occupations and professions. Next. And this is now the model that we propose, which is a complementary model, because the focus here is much more on the employment contract, not so much on the task profile, but on the employment contract. And as an employee, you put your effort because you want to meet the demands at work. But often the rewards that you receive in recompense for your effort, they are not adequate. And you can see this imbalance between high effort and low reward. And this imbalance matters as a source of stress. Importantly, we do not only talk about money. Reward is not simply money, it's also status, it's security of job, it's promotion prospect. And then it's also the non-material dimension of reward, which is recognition, esteem, and appreciation. The model is a bit more complex because it also includes a personal component, but I will actually focus on these extrinsic components of high effort and low reward. Next. The question is then, of course, why do employees continue to work in such a situation with high effort and low reward? And there are several reasons. One important reason is that many employees have no alternative choice in the labor market. If you are older, if you don't have high mobility, if you don't have a high level of skill, you simply may not find an alternative job. So sticking to an unsatisfactory job is still better than getting unemployed. A second reason, many people suffer from heavy competition. For instance, a risk of downsizing. So they continue with their job even under conditions of high job instability. And under heavy competition, many people do what we call a strategic investment. In particular, young employees, they say, that's okay if I don't get highly paid. The most important thing is that in the near future, I then will have my good chances to get a good job. So they spend their efforts even under conditions of low payment. We can find in many studies, at least across Europe, between 10 and 30% of all working people experience their job as a high effort, low reward condition. Okay, can we continue? As you can see from this slide, there is a strong relationship. The higher your economic position or your occupational position, the lower your level of work stress. This has been shown in a large study across Europe, and you can see the orange, the orange curve, the orange slide part. These are the low-skilled people, and the gray part. These are the high-skilled people, and in between you can see a kind of dose-response relationship. So the lower the occupational position of working people, the higher their psychosocial stress at work. And this holds true for the effort-reward imbalance model. And this also holds true on the right-hand side for the dimension of low control of the demand control model. This means the message is that in particular, lower skilled people suffer more from work stress than higher skilled people. This is, I think, a very important message also for preventive measures. Next. I think I will not talk about the measurement. I will just say for both models, the demand control and the effort reward model, there are now psychometrically tested questionnaires with scales which can quantify the amount of effort and the amount of reward. And then you can even compose a combined measure, a ratio which quantifies the amount of the imbalance or the balance between effort and reward. But I will not go, for reasons of time, I will not go into details of the measurement. You can have a look at the website of the questionnaire. You can also write me an email if you need more information. Next, and next, yes. And this is interesting. This is the scale, this is this ratio which quantifies where do you stand with your effort and reward imbalance. If you have a perfect balance, if the effort is matched completely with your reward, then you are at this red line of 1.0, as you can see. If you go to the right side from this graph, the higher you go, the higher is the imbalance between high effort and low reward. And what this slide shows, this is the risk of suffering from depression. And you can see there is a real increase from low depression if you are balanced with effort and reward, to a very high risk of depression, 5 times as high if you suffer from this imbalance between high effort and low reward. So you can really measure, quantify this discrepancy between effort and reward. Next. There are 2 stress-related disorders, coronary heart disease and depression, where the current scientific evidence on the adverse effects of stressful work in terms of these 2 models has been demonstrated most in a most valid way so far. However, more recently, there were also studies showing that work stress increases the risk of type 2 diabetes, of musculoskeletal disorders, of addictive disorders, for instance, alcohol abuse, medication abuse, sleep disorders, sickness absence, and poor health functioning. So there are many other health complaints, but I will focus on these 2 highly prominent conditions, coronary heart disease and depression. And the way how we demonstrate the evidence is the so-called prospective cohort study, which means that you follow thousands and thousands of employed people over time. And in the beginning, you measure the work stress. And then after 2, 3, 4, 5 years, you look who is getting sick, who got a myocardial infarction, who got an impression. And then you analyze, is there a relationship, an association between work stress and the risk, the elevated risk of getting a disease? Okay, so this is a picture which shows that your vessel, your coronary vessel, is full of atherosclerosis. So this is a biological process, and the question is it possible that psychosocial work stress has a direct effect on narrowing the vessels? And the next slide shows, indeed, this is the case. For instance, this is the result from a study on blue collars in Finland. And they were followed over 4 years. And you can see the red bar in the back with 0.33 millimeter increase of the cardiovascular plaque so they analyzed the carotid atherosclerosis in these blue colors. And there was one group with a very accelerated increase over the 4 years. And that was the group of blue colors with high demanding, high effortful jobs at the same time with a very low, very critically low economic reward. So you can see that in this group, carotid atherosclerosis was increasing much more rapidly than in the other groups. Next slide. Let's go to the next slide. Let's try, doesn't seem to work. I'm sorry. That's a pity, because it is the slide which would show that those suffering from high effort and low reward, and those suffering from low control at their work, that they have twice as high a risk of new incident coronary heart disease after 5 years observation period. And this is a famous study from the British Whitehall 2 study. I'm sorry that I cannot show you this. I don't know what was wrong with this slide, but let's go to the next slide. And the next slide shows that there are now more than 20 studies which analyze the relationship, which show the relationship between work stress and the risk of coronary heart disease. And if you take all the studies together, more than 20 studies, you can see there is a substantially increased risk of 40 to 60% between those suffering from work stress compared to those who have an agreeable job without a high level of work stress. And if you think that every fourth worker, at least across Europe, and I think in Latin America, there may even be more, every fourth worker is suffering from work stress in terms of these models. A 40% relative risk increase is really an important information which calls for prevention and for reduction of work stress. Can we go on? Now, often employers say, well, this is all statistics. We do not need to believe that this is true. And you know, we are living in a time of fake news. So we really need scientific truth. And scientific truth means that your phenomenon, work stress, can be measured, can be demonstrated by measurable facts. Now, I give you just one or two examples of how you can demonstrate immediately that work stress affects your body. And the first example is on this slide, and it relates to the demand control model. And you can see that workers suffering from low control at their work, this is the upper line in the graph above, that they have an increased level of systolic blood pressure throughout the whole day, from morning until evening, and also the diastolic blood pressure. So you can see immediately there is a direct relationship between what you experience at work and how your blood pressure responds, reacts to the situation. Next. And the same for the effort-reward imbalance model. Again, on the upper screen on the left side, you see heart rate monitoring over 3 days, Monday, Thursday, and then on a non-working day. And you see in particular, during work days, on Monday and on Thursday, there are increased heart rate during work among people who suffer from work stress in terms of high effort and low reward. And also on the second slide below, you can see the same. No, this is systolic blood pressure, sorry. And below the slide, you can see the same for heart rate. High heart rate during work, but not at all during non-work, during your recovery. So these are just two examples. Let's go on. The other health problem is depression. And depression is a serious public health problem with an estimated prevalence during life between 13 and 16%. Depression is also severe due to what we call comorbidity. So people with depression also have a higher risk of cardiovascular disease and a higher risk of suicide. Unfortunately, depression often gets manifested in early adult life, compromising workability often for a long time. So there are many risk factors of depression, genetic, early life, and so on. But work stress also has a role in causing depression, as I will show. Next. This is probably the first study on the two work stress models, effort-reward imbalance and low level of control at work across 3 continents. On the left side, the continent of USA, in the middle, the continent of Europe, and on the right side, the Japan. I'm sorry, I don't have slides for Latin America in this study, not yet, but there are studies from Latin America as well. And as you can see, these are older people, so they are 50 plus, working people 50 plus. But you can see on all continents, in all countries, those suffering from stress at work, in terms of these two models, they have elevated risks of depressive symptoms. And this holds true. This is statistically significant, with one exception. In Japan, low control is not significantly elevated, but all other effects are statistically significant. Can you follow? Is this okay?
Yes, sir.
Thank you. So this slide is quite interesting because it shows the long-term effect, the long-term effect of stress due on disability pension due to depression. And you can see this is from year 1 to year 10. And you can follow these 51,000 employed people from Finland, which were followed for 10 years. And in all these 51,000 people, work stress was measured in the beginning. And then you can see after 5, 6, 7, 8 years, you can see that those with the highest amount of work stress, this is the quartile number 4 with the highest level, yes. And you can see they have a very increased risk of disability pension due to depression. And that often means they have to retire early from working life. So this is really crucial also in terms of preventive efforts to increase healthy work. And next, please. Again, if you put all the evidence together from all the studies worldwide on effort-reward imbalance and on high demand and low control, you can say the risk of depression in all studies together is about 70% increased if you suffer from work stress compared to those who have a non-stressful routine working condition. Okay, I think we go on. In conclusion, exposure to unhealthy work in terms of these two work stress models is associated with increased relative risk of these two stress-related disorders, in particularly coronary heart disease and depression. Despite a limited increase in relative risk, for instance, a doubling of risk, despite this is limited, we don't say it's tenfold increased, it's just 50 or 60 or 70% increased. Despite the limited increase of relative risk, the impact of work stress in terms of the population, in terms of the public health is considerable, because at least 25% of working people are exposed to these stressful conditions. And it is likely that the burden of disease will be amplified, will be strengthened by the new pandemic threat of COVID-19. I don't have figures on this. Next slide. Next slide. But it is clear that in addition to the direct effects of the new pandemic, there will be indirect effects in terms of work from home, in terms of job loss and unemployment, in terms of poverty risk, risks of lack of social security, and in terms of social isolation and loneliness. So we will have to deal in the near future with both the direct and indirect effect of COVID-19, in addition to all the work stressful conditions I have mentioned in my lecture. Now at the end, next, I would like to raise very briefly the implications for prevention. And the first message is we need to, or you need to monitor. You need to monitor stressful conditions, and you need to provide safety and health measures once these conditions are monitored and once you can develop measures in order to reduce the workload. And there are laws, there are hard laws and there are soft laws available. The International Labour Organization and national laws are available. And I think it's important to strengthen surveillance and registration to monitor these adversities. There are also voluntary obligations between employers and employees where you can implement standards and implement models of good practice. However, it is important that these all activities are taken in a participatory way, including both employers and employees, and having trade unions in addition to the management, because just together you can promote the conditions. Next. I will not go into details, but there are tools for monitoring. There are also ways to do this with administrative data. OECD has a guideline for measurements. So there are many, many ways. I cannot spend my time now, but other contributions will show you. And of course, there are websites which indicate how you can measure what kind of tools you can use for surveys of employees within companies. Next. I think this is a very crucial message from my presentation, that in order to improve healthy work in companies, you should distinguish 3 levels. The first level is personal. Of course, you can strengthen the individual working person. You can teach him or her how to cope with stress, how to improve relaxation. However, this does not change the stressful situation. Therefore, the second level is important, which is interpersonal level. You should improve leadership. You should improve communication, information across your company. But this is also not enough. That's why you need a structural level. You need the organizational level. And actually, there are already several interventions which are based on the work stress models which I just introduced here, and which try to improve healthy work by measures at this organizational level. You can see a few examples. Very important is improving the work time management. So reducing effort, reducing demand. You can improve the division of work. You can, for instance, increase the job rotation or the task variety, reduce effort, reduce demand. You can strengthen the teamwork. You can restrict exposure to high stress exposures. Importantly, concerning reward, please see that that's for the employers. Try to transform informal work contract into formal work contracts, because the number of informal workers is still extremely high across Latin America. I think having a formal work contract with social security, with a certain minimum of safety and control and reward is most important. Fair wage and fair salary. For instance, compensatory wages for people who have very heavy jobs, compensate their extremely dangerous and stressful jobs, compensate these conditions if you cannot change them by at least by high wages. And then most important, to strengthen reward and to strengthen mobility and improvement of prospects of promotion, increase the options of training. So my last slide will show that this works. You can really be successful in transforming such measures of organizational developments into practice. Just the next slide, please. And this is a slide which shows an intervention study in hospitals in Canada. And at the left side, this is the experimental hospital where demand was reduced, control was increased, support was increased, reward at work was increased, and the balance between effort and reward was improved. And on the right side, you see the control hospital. And then the third line shows the statistical difference. And all the red numbers on the third column show that even after 3 years, the experimental hospital, nurses and doctors in this hospital improved significantly through the intervention. And most importantly, their level of burnout was significantly reduced even after 3 years. So this is one of a number of interventions which demonstrate that you can reduce work stress and you can improve your health by this kind of measures. And finally, although you may, as employers, you may be devoted to improving the working conditions of your employees, that may not be enough. You may even need the national labor and social policies which further support strengthening healthy work. You need the help by national policies of active labor market participation. You need to improve the legislation on employment contracts. You need some policies to enforce fair work standards, including occupational health and safety measures. And on my last slide, I show you that this really matters. This is a study which shows on the x-axis, you see the number of measures taken by national policies to improve the integration of workers into the labor market. So how easy is it for an unemployed to come back to work? How easy is it for a woman after delivering a child, after having a child, to go back to work? So integration into the labor market. And you can see there are countries like Denmark, Germany, Netherlands, with very, very high measures of integration. And there are countries like Greece and Italy or Poland with very poor measures of labor market integration. And in these countries, you can see the level of work stress is extremely high in the countries with very low integration measures. And the level of work stress, the mean level of work stress of working people in the countries like Denmark, Netherlands, Sweden is very low. So you have a very close association between what your national labor market policy is implementing and what the level of work stress, of mean work stress among working people in these countries can be. I come to the end, last slide, with 3 conclusions. My first conclusion: despite progress, modern working conditions still contribute to a high burden of disease, mainly through psychosocial stress at work. Scientific research has developed new knowledge on these associations and defined entry points for developing preventive programs. Implementing these programs in order to strengthen healthy work at the level of companies and at the level of national policies is a major challenge for the near future. Gracias. Thank you very much.
Professor Siegrist, thank you very much for your lecture. We really enjoyed it. I want to share with you that 833 persons that hear your lecture. Now we are going to be in the session of questions and answers. Please. Yes, sure. 1 second, please. Le doy la invitación a todas las personas que quieran hacer preguntas. Lo pueden hacer a través del módulo de preguntas y de respuestas. Viviola Gómez ha estado apoyándonos durante la realización del evento, recolectando algunas de las preguntas que ustedes han elaborado. Dr. Siegrist, as I told you, we are going to make the questions and answers. So Viviola is going to share with us some of the questions that our invited people make to you.
Sure.
Okay. Viviola, you have.
Should I make them in English and Laura translate them for the rest of the people?
Sure.
Okay, Dr. Siegrist, I have here like 18 different questions and comments. So some of them are really complicated and long probably to answer, but I will present them. I will try to present them all. So the first comment from a person was that if decent work is not a subjective concept, this person believed that decent work is different in Europe, in the US, and probably in Latin America. And if we should not like define different decent work in different parts of the world is the comment. Did you hear me? Or Laura? Otras, no sé si él me escuchó.
Professor Siegrist, do you hear the question from Viviola?
No, unfortunately, I could not hear it.
Ok. Laura, mejor la voy a hacer en español y tú la traduces. ¿Tal vez?
Okay. Yeah, now I can hear you, yeah.
Can you hear me or can you hear Laura? Ok. Sebastián, ¿tú sabes que estos idiomas...
Viviola, ¿puedes hacer la pregunta
en inglés o en español?
En español y Laura se lo va a traducir al doctor Johannes.
La pregunta para el profesor Siegrist es para un comentario. Una persona dice que el concepto de trabajo decente, decent work, es subjetivo. Y por eso esta persona piensa que es un concepto que debería tratarse y definirse distinto para Europa, para Estados Unidos y para Latinoamérica.
Okay, thank you for this question. in the beginning of my talk, I mentioned that probably in Latin America, that many working conditions are still less well developed than in Europe. Europe has the privilege of, despite the financial crisis, 2008, 9, 10, 11, despite the financial crisis, Europe has the privilege of developing quite strong national labor market policies and also economic growth. The number of unemployment is relatively low. And I think in Latin America, the conditions in many countries, what we hear in Europe, in many countries in Latin America are much less developed. So actually decent work in Latin America would mean that you should focus primarily on improving formal work contract, on improving adequate salary, on improving job security, on offering occupational health and safety measures to all working persons if possible. And I think these things are much more important still in Latin America if you talk about decent work compared to Europe. But still, even then, the level of work stress in Latin America may be as high as in Europe.
Okay, la siguiente pregunta, someone asked, o alguien pregunta si usted tiene estudios que muestren el costo de la recuperación de los empleados para las compañías. Si las compañías dan tiempo para recuperación o las personas se enferman, ¿hay algún estudio que mire el costo de la recuperación?
Yes, there are economic studies. First of all, in Europe, we have sick leave benefits. So if you are unable to work at least for a couple of weeks, you are covered. So you don't need to suffer from poverty. You are covered by your insurance. And so the sick leave system in Europe is quite well developed. I don't know the details about your countries in Latin America, but this is absolutely essential. And if you don't have enough sick leave compensation, then the problem is the so-called presenteeism. That means that you go to work because you are afraid to lose your job, even if you are sick. And this is a very, very poor and a very, very bad condition. So the implication would be try to implement sickness benefits, sickness insurance at the national level as soon as possible.
Okay. Hay una serie de comentarios y preguntas que se refieren a que cambiar la cultura institucional en Colombia es muy complicado. Muchas personas afirman que las empresas están más interesadas en la producción y en el rendimiento económico que en la salud de las personas. Varios dicen que la seguridad y la salud es como una piedra en el zapato para muchas empresas y por eso varios preguntan como qué hacer en estas circunstancias donde no parece tan fácil cambiar las políticas institucionales o lograr que las empresas realmente estén interesadas en la salud de las personas.
Unfortunately, this is a most often heard reaction from several employers because, of course, in capitalism, you have to invest into short-term profits. And short-term profits do not take into account the long-term costs of poor health at work. And this is a real problem. So you have to show, to make sure that in the longer run, at least after 2, 3, 4 years, investments into good health pay off. So employers have to learn that not from today until tomorrow, you cannot make profit with good work. But if you have 2 or 3 years as a perspective, as an employer, then investing into the health of your employees pays off. So actually, this is a message which is important for employers. But I'm sorry to see again and again, under the pressure of capitalism and of competition, some employers say, I'm sorry, I have to survive. I cannot invest into the future. This is a very bad situation. But please take into account, in the longer run, investing into health pays off. Okay?
Una persona afirma que ve una diferencia en la tolerancia al estrés entre personas jóvenes y personas mayores. Esta persona dice que nota young people, personas jóvenes con menor tolerancia a trabajar bajo presión. Pregunta si usted tiene alguna sugerencia de cómo manejar esta situación.
Yes, thank you. Actually, of course, you have to handle the problems differently according to age. But it is a mistake to say, young people, they can do everything. It doesn't matter. They are healthy. They are strong, because we can show with the cohort studies which now follow employees over 10 years, we can show that those exposed to work stress at age 30, after 10 years, they already suffer from cardiovascular risk, from metabolic risk, from depressive risk. So it's not good to say if they are young, you don't need to be concerned. You should invest into stress prevention at any rate. Of course, among older people, things are much more difficult, and there must be ways to help older people to reduce their work stress in order to survive. I mean, to survive until retirement age. This is, of course, then a very specific job. And in Europe, we can see that despite all progress, even in Europe, training for older people, skilling people above age 50 is not well developed. So even in Europe, where you have relatively good progress, occupational skilling and training of older people is still a very, very poor condition, and it may be even worse in your country.
Okay. Thank you. There are más preguntas. Una persona pregunta si hay estadísticas de cómo el estrés laboral afecta la productividad.
I think this is an interesting issue, because in the short run, you can increase productivity by spending high effort at work, by following the high demands. And as you have seen from my model on effort and reward imbalance, there was also a personal component. And there are people who are keen to be the best, to not only to accomplish 100%, but to accomplish 110 or 120%. So people may, in the short run, high work stress may be productive, but after a certain time, then this leads to breakdown. This leads to exhaustion. This leads to productivity failures. This leads to mistakes in the production. And so in the longer term, the correlation is a negative one.
Okay.
Okay.
Okay. Hay aquí varias preguntas que van en la dirección de que, dado que muchas compañías en nuestro país no pueden hacer mucho para mejorar la salud emocional de sus empleados, la pregunta es, ¿qué podemos hacer nosotros, por nosotros mismos, para superar los efectos del estrés en nuestro organismo y al mismo tiempo no escapar de nuestra realidad?
Yes, you may have seen on one slide, I distinguished the 3 levels of intervention. And of course, you can do quite a lot at the level of personal stress management and improving. For instance, there's an important word which is resilience. You can strengthen the resilience of a person. You can instructing the coping opportunities. I think this is, if there are no measures to improve the working conditions itself, it is still better to improve your resistance than to resign or to do nothing. And there are excellent programs for persons, even online programs, which are quite effective to strengthen coping with stress, to strengthen resilience. But let me say, it's also very important to strengthen the recognition at work. This is not highly, this doesn't cost money. This is just an issue of training, and this is an issue of awareness. Increasing appreciation and recognition is certainly something quite often quite important as well.
Okay. Hay una pregunta de cómo monitorear. ¿Me escuchas, Laura? Ok, la pregunta es si cómo monitorear e identificar de manera temprana los problemas que pueden generar estrés laboral.
Yeah. I said there are different tools available to monitor work stress. And I think this is something which needs to be done at the company level. You can use very simple tools. You can use scientifically approved tools. I think this is something you have to deal with your experts at the local level. But importantly, do not use tools which have no scientific evidence. It is important to have scientifically sound instruments, because many people are doing some business with poor tools. They sell their tools, but they have no substance. So use psychometrically valid tools like there are several tools like demand control or the effort reward imbalance or from Scandinavian. So there are several tools, but your experts will guide you through these tools.
Con respecto a instrumentos, quiero decirle más a los participantes que al profesor Siegrist, que más adelante en esta serie de eventos vamos a tener una sesión donde vamos a mirar un poco el tema de los instrumentos. El doctor Siegrist mencionó su propio cuestionario. Yo más adelante puedo contarles, porque yo he trabajado con el cuestionario del profesor Siegrist, yo lo tengo en español, yo lo he validado en Colombia, pero más adelante en una sesión que tendremos les contaré cuál es el problema que tenemos en Colombia para usar el cuestionario del profesor Siegrist o el cuestionario del profesor Karasek, del cual hablaremos la próxima semana. Pero digamos que de pronto no es el momento de entrar en ese detalle. Pero para el profesor Siegrist, la pregunta es, hay muchas personas preguntando por diferentes tipos de intervenciones y muchas de ellas preguntando su opinión sobre intervenciones más de tipo individual, como meditación, relajación, cosas de este estilo, que de todas maneras más adelante en esta secuencia vamos a tener sesiones dedicadas a intervención. Pero dado que hay tantas preguntas para el profesor Siegrist sobre intervención, me gustaría ver si usted tiene, profesor, alguna recomendación general sobre dónde se debe hacer el énfasis de intervención, porque muchas personas parecieran pensar que la intervención debe hacerse más sobre la persona, dado que las empresas parecen no estar muy dispuestas o no tiene la posibilidad de hacer intervenciones de tipo organizacional. De hecho, una persona dice que por los altos costos y los impuestos que tienen las empresas, muchas empresas no tienen la posibilidad de hacer cambios organizacionales.
Thank you so much, Vigor. I think this is a major issue even across Europe. The majority of healthy work campaigns are at the level of improving behavior, improving relaxation, improving resilience, improving nutrition and exercise, and only a minority so far are addressing the structural level. However, according to the evidence which I showed and which my colleagues will show in the next few sessions, probably in your series of lectures, they indicate clearly that you need the structural level of organizations and that you certainly need the national policy level to improve working conditions in order to make a difference, in order to make progress at the population level, at the level of whole working populations. That's why I think we need to stress structural measures at the organizational level and at the level of national labor and social policies. This is my message.
Hay una persona que comparte una idea, dice, yo quiero compartir una idea que puedo usar en otras compañías. Una forma de reducir el desbalance entre el esfuerzo y la recompensa es el incentivo real, is True Incentive Payment Scheme, esquemas de pago que incentivan realmente, esa es la traducción porque lo escriben en inglés, independientemente del salario y del trabajo, cuando el empleador ofrece e incentiva pagos basados en los resultados, motiva a las personas para trabajar por su reconocimiento. Por ejemplo, en nuestra compañía, nosotros creamos un incentivo para las áreas productivas, para las personas que tienen salario mínimo. Nosotros ofrecemos un pago extra equivalente al doble de su salario por los 3 empleados o para los 3 mejores empleados de cada mes y con un viaje al final del año para los 3 mejores empleados. Con este esquema, la compañía incrementó la productividad en 30%, redujimos el ausentismo y las personas trabajan con una mejor actitud. Y no depende del gobierno. No sé si el profesor Siegrist me entendió toda la descripción, pero sería interesante oír su opinión sobre
Yes, I think the evidence indicates that incentive payment may be okay to a certain level, but it should not be excessive. It should just be a supplement, a minor supplement to an already fair payment. So if you do excessive differences between minimum wage and, let's say, doubling or elevating 3 times the payment by incentive, by exploiting high level of effort, I think this is, in the long run, this is not a good strategy. So having incentives to increase payment to a moderate extent, I think this is okay, but starting from a fair payment level and not exploiting the difference to the minimal wage. So I think this is the evidence from current scientific economic studies. So moderate increase of incentives is okay, but not excessive incentive-related payment.
Okay. Una pregunta es cómo se puede saber si los síntomas depresivos son consecuencia del trabajo o si esos síntomas estaban antes y generaron los problemas en el trabajo.
Sorry, I did not understand the question.
La pregunta es cómo saber si la depresión es consecuencia de las condiciones laborales o la causa de que la persona tenga estrés en el trabajo y tenga problemas en el trabajo.
Yeah, it is both, clearly. Clearly, depressive people have lower level of coping with stressful work. And so if you ask depressive people, then you will show higher levels of work stress. This is why the prospective epidemiologic studies are so important. So we start our studies with healthy people. We control for depression at the beginning. We exclude people who have depression from the studies which we are doing. And then we really show that high level of work stress assessed at the beginning, after 3, 4, 5 years, leads to increased risk of the first depression, the first manifestation of depression. Then you are sure that work is the cause and not the consequence of depression. But there's no doubt that there is also a reverse condition, that people with depression are susceptible to a high level of work stress. That we prove the causal relationship via these prospective long-term studies. Okay?
Aquí voy a hacer la última pregunta. Hay muchas preguntas que van a ser respondidas probablemente en sesiones posteriores porque se refieren mucho a intervenciones o forma de prevenir o a la ley. Pero hay una pregunta aquí que dice, ¿cómo identificar si el estrés es de origen laboral, entendiendo que el estrés es multicausado? De hecho, la ley en Colombia casi que indica que hay que evaluar también condiciones personales para determinar si el estrés de las personas en el trabajo es originado por sus condiciones laborales o por condiciones personales o familiares. Y creo que es una pregunta muy importante, profesor Siegrist, poderle explicar a la gente cómo detectar.
Yeah, it is an important question, absolutely. And maybe the work is not yet perfect. The scientific evidence is not yet perfect, that we always are sure to exclude that there's an underlying extra work or private life burden which is underlying the measure of work stress. So we cannot totally exclude it, but our figures show that as we have prospective studies with many additional information on person situations, we can statistically control for personal factors and exclude their influence.
Okay. Profesor Siegrist, muchas gracias. En este momento ya no vamos a hacer más preguntas y algunos que enviaron preguntas que no presenté es porque repetían lo mismo o porque son temas que se van a ser tratados en sesiones posteriores y que no podríamos tocar en este momento, ¿sí? Por eso voy a dar finalización a la sesión de preguntas y de nuevo quiero expresarle al profesor Siegrist mis agradecimientos por su disposición. Sabemos que es tarde en Alemania en este momento y que él debe estar cansado terminando su día.
No problem.
Pero
no problem.
Muchas gracias. Muchas personas están agradeciendo sus aportes, sus comentarios. Muchas personas dicen que es lo mejor que han escuchado en su vida, que han aprendido mucho. De manera que creo que es importante que usted lo sepa, que las personas están muy agradecidas, muy llenas de aprendizajes que creo que van a poder mejorar sus trabajos. Y como vienen otras sesiones, seguramente van a poder complementar lo que usted nos ha enseñado. Dankeschön.
Yeah, but I want to thank you as well. And I hope that the situation can be improved by this initiative, which is a very good initiative. I'm very pleased. And I wish you all good success. Thank you.
Gracias.
Okay.
Gracias.
Thank you very much, Professor Griffiths.
Okay.
Bueno, muy bien. Muchas gracias
Bye,
a todas las personas que nos han acompañado.
Bye, bye.
Bye, bye.
Esperamos verlos en el próximo encuentro. De nuevo, un agradecimiento muy especial al profesor Siegrist, a Peter Schall por hacer posible todo este proceso, a Viviola, a ARL SURA, a todos ustedes por participar y decidir estar en este encuentro. Los invitamos a diligenciar el formulario de asistencia y nos vemos el próximo viernes en una nueva sesión de este ciclo especializado de formación, trabajo, salud y estrés. Hasta pronto.
Bye, bye. Chao.
Okay.